There is a weight loss injection now in the market, and here is what's scary. Ozempic just went from costing rupees 4,000 a week to costing just rupees 325 a week, suddenly making this drug affordable to millions of Indians struggling with weight loss. And this is dangerous because nobody's talking about the side effects. See, when you get on these GLP-1 injections, be it Ozempic or Mounjaro, you see results fast. Basically, भूख ही नहीं लगेगी तो इंसान खाएगा क्या? In clinical trials, people who stopped taking these injections regained 2/3 of their lost weight within 1 year. Blood pressure, blood sugar, most health markers went right back to where they started. In fact, a 2026 Oxford study found that the weight regain after stopping these drugs is actually faster than after stopping a regular diet and exercise program, because the drug only suppresses your appetite, but it doesn't teach you anything about how to eat or how to train to actually stay fit. And remember, this drug is new, so we don't have any data on what this drug does to your body 10 to 20 years down the line. And let me tell you the worst part. Up to 40% of what you lose on these drugs is muscle, not fat. So when you stop taking the injections, the body fat comes back, and it now replaces the muscle that is no longer there. You return to the same weight but a worse body and a slower metabolism, and you are basically left with a harder battle than the one you started out with. Now, for someone with actual diabetes, heart disease, or severe obesity, this drug can be a medical intervention, because here the trade-off is between the risk of the drug versus the risk of the disease. But this is now 325 a week, and jumping on this injection just to lose a few kilos is simply being reckless with your body. If you are someone who has ever lost body fat with proper calorie deficit, protein and strength training, what would be your advice to someone who is tempted to jump on these GLP-1 injections? Tell me in the comments.